Hello, my name is Dalia Kaakour. I'm a PGY3 internal medicine resident at the University of California, Irvine, and today I'll be presenting a poster. It's actually a case series on 3 patients with advanced cholangiocarcinoma who we saw durable responses to on dual agent immunotherapy with ipilimumab and nivolumab. So what's unique about this case series is that it provides 3 examples of patients that are still seeing responses on this dual agent immunotherapy after having failed multiple lines of therapy, cisplatin, gemcitabine, irinotecan, capecitabine, and then pembrolizumab. Patients 1 and patients 3 were on pembrolizumab for just a short period of time, each of them just 3 cycles before CT imaging as well as clinical findings suggested that they were not responding to therapy, so those pembrolizumab was stopped for them at that time. And patient number 2 actually completed 27 cycles of pembrolizumab before we saw disease progression, both clinically and per CT imaging. So today, all 3 of these patients continue on dual agent immunotherapy with ipilimumab and nivolumab. Patient 1 is on the 27th cycle now. Patients 2 and 3 are around the 9th cycle now, and they all continue to have partial response on CT imaging and also clinically are doing well. So this is remarkable as, first of all, the closest trial that has been completed so far that kind of touches on this topic looks at ipilimumab and nivolumab dual agent immunotherapy on patients with advanced cholangiocarcinoma. However, it then switches to monotherapy after a short period of time. It does not look at the durable response with the dual agent immunotherapy. So this is why this is unique, and there are no trials so far that have looked at this specific topic. So all these patients were diagnosed. The earliest one, patient number 3, was September 2018, and the other 2 were diagnosed in 2019. And the fact that they're all still living and doing well today is quite significant. And here we have figure 4. Patient number 2 showed very significant findings in terms of the decrease in her tumor markers. So as you can see here, there's a small blip. This is when the patient was on pembrolizumab, and the CA19-9, that's in the black line here, decreased significantly. And then this is after she was on for 27 cycles doing fine on pembrolizumab. Disease progression, you can see the markers trend up, and then started on the dual agent therapy. You see the response here has kind of settled down. So I think moving forward, it would be interesting to look at a larger number of patients who are on this or similar lines of therapy, and just asking questions for investigation, like what's the appropriate timeline that they need to be on this dual agent therapy for, what sequence is optimal, is it better to do single agent than dual agent, what combination of agents in that sense. Thank you.